Good evening, and thank you so much for keeping it right here at Hope TV. Look and live. My name is Grace Mutis, and welcome to Health Check. A beautiful Tuesday. I hope you've been well and you're tuning in to Health Check. We have a great program lined up for you. And this beautiful day, we want to talk about children growth and development, the growth and development of your child. And if you have any question related to today's topic, please reach out to us. Our SMS line is 22232. That is 22232. You can also get us on YouTube and Facebook. Our handle is at Hope TV Kenya. And any question you have regarding your child growth and development, we'll be glad to answer you. We are hosting Dr. John Wachira. He is a pediatrician, and he'll be glad to answer all your questions. And I know for you who is watching us, and you are maybe a first-time parent, this topic is very critical. Or maybe you have several children, and you know the way your told child, the firstborn is different from the secondborn and thirdborn. So their journey of growth and development is so different. What do you need to do? So stay tuned, and I know we are going to have a great time as we learn a lot. Allow me at this point to introduce to us Dr. John Wachira, a pediatrician, to help us discuss this topic. Good evening, Daktari.
Good evening, Grace.
How have you been?
I've been fine. Had a busy day.
Yes.
Yes, but all is well.
Amen.
Yes.
Thank God. I'm sure many parents have still kept coming to see you with their little bundles of joy. Worried, how are they doing?
Yeah, babies come any day, anytime.
Yes.
No longer anywhere, at least the hospitals.
Yes.
So that means you can't, you can almost say you have a child coming into hospital every day.
Yes. Thank you, Dr.
Yeah.
So let's start our discussion today. And, when we talk about a child's growth and development, what is that all about?
Simply put, growth is increase and development is increase. Just depends on what you are looking at in terms of when you say a child is growing, you mean they're increasing. And they're increasing with our eyes, they're increasing in their weight, they're increasing in their height, and they're increasing in any other measurement you can take from head circumference to the length of the hand and any other body organ that is measurable. So the growth is that aspect that is almost measurable in terms of physical growth, but it can also encompass many other aspects of growth. You're talking about social growth, you're talking about intellectual growth, you're talking about cognitive growth, but that again tends to be now mirrored in what people refer to as development. Developing is a metamorphosis. It is changing form or changing shape or changing size. They are closely related. So we tend to use growth more for the physical and development for the other things. But you are looking at how is the cognitive growing, how is the sleep growing, how is the behavior growing, how is the speech developing, how is the language developing. So all those things is what you're looking at when you say growth and development. Yeah.
So it seems those two words, growth and development, have a close relationship.
Yes, I mean they both imply progress. There is a progressive increase in either size or cognition, or or the way they handle their sleep and the way they interact with people, the way they relate, all that.
Yeah, and I'm sure, Doctor, in your practice, you've met so many parents who come in and say, "I'm concerned about the growth of my child," just that way. So, what are the common questions that parents have brought in as cases regarding their child's growth and development?
Over the last, say, 100 years, the World Health Organization and the UN bodies, it may not be 100 years, but at least more than 50 years, they have come up with common things that people are worried about, and that's what most people look. They are put down to as milestones. So the biggest question every mother is asking themselves is my child achieving the milestone for the age? Is my child growing up well? And that's why you have simple things that have been going on all over the world under the guidance of the government, that every child should have their weight taken every month. That way, you're able to monitor their growth, and you'll be taking at birth what's the weight at birth. And if you just take something as simple as at the birth, all mothers will be worried: is a birth weight okay?
Yes.
for a baby?
Yes.
And you know that one alone is affected by 4 or 5 things. One is a baby term. If the baby is preterm, they will be smaller. 2, how is the health of the mother? If the mother has high blood pressure or other health conditions, the weight will be smaller. Again, the other thing is Are they twins? Are they is it a multiple pregnancy? If a baby is one, they'll have a better weight, higher weight than the one who are twins or triplets. So they are also looking at other things about the baby themselves. How does the baby got any health defect? If a baby has got some health defect, they may also be born smaller. So you have all those factors affecting the birth weight. Then from that, then you start looking at the first 2 weeks, the first 1 week, all babies will lose weight from 5-10%. If they were 3 kilos, they lose 300 grams.
What does that happen, Daktari?
They're losing a lot of fluids from the body. Inside they were in a pool of water. They were soaked in water anyway.
Yes.
Now they come out in this dry, different environment, and they lose a lot of. They lose water by many means. They also had a lot of black poo, the meconium. They also lose out all that. That was part of their birth weight, among other things anyway. So that's what happens with the weight. Then now from two weeks, then they should start regaining their birth weight, and gaining some weight if they are feeding well, and then they move on. You just take weight alone. By around 5-6 months, they'll have doubled the birth weight. If there were 3, they are 6. If there were 4, they are going to 7, 8.
Yes.
Then you take all the way to about 1 year. 1 year they'll have tripled the weight, they'll have tripled the weight. If there were 3, they are around 9-10 kilos. So you have got that increase in weight. Then from 1 year they slow down on the weight gain.
What happens?
Yeah, so because they are active now, they are crawling, they are cruising, they are walking, they are dancing. They're doing all sorts of things.
Yes.
And then now, so the weight gain now slows down. And you get between 1 year and 2 years, at most they'll gain 2 kilos. Whereas a child gained from 3 to 10, that is 7 kilos. Between 1 and 2 years, they'll only gain 1 or 2 kilos. And that becomes a big concern for most people, for most mothers. Again, as they go to 2 to 3 years, the same thing, they gain 1 to 2 kilos. So you have got that trend, and that's what we have, what is has been made up by the world bodies as the growth charts. That's for the weight. It will be different for boys, it will be different for girls. For some reasons, girls are relatively smaller compared to boys for the same age, the same population. Yeah, but I mean that's just a generalization, because you can have girls who are bigger than boys anyway.
Yeah.
But you have different charts for that. Even height, the same. I may not talk too much about the height because most parents don't cram the figures for the height, but they keep on increasing the height.
Yes, yes.
Again, the height is guided by the height of their parent. If you have got tall parents, they're likely to have tall babies, so the height will be different for that. Same thing with the head. The head, most babies will be born with about, let's say, 35 to 40 thereabout centimeters, and they'll start increasing 2 centimeters maybe per month the first 1 or 2 months. Then they go to 1 centimeters per month the next 3 months. Then they go to about half a centimeter the next 3 months. So you find the head gets bigger in the first few months, then now stays that way. By 2 years, now the child looks like the relatives. The head doesn't look. It's no longer growing. It has taken the shape of the relatives of the family. Yeah.
Yeah.
So you have got that's in terms of growth, in terms of the head circumference, the height, and the weight. Okay. Those are simple things that one can look at. But the weight becomes very important, because if a baby is not, we always insist all babies born should have their weight taken at birth. If in a good facility, the weight taken also at discharge. If not possible, then take the weight again at 2 weeks. By 2 weeks, you can see if the baby is regaining their birth weight and increasing. If they are not, there is trouble. That baby is not feeding well. 90% of them, they are not just feeding well.
Okay.
Yeah, and those are babies who will be crying a lot, and then mothers will be thinking it's colic pain when the baby is just hungry. So that could be a danger sign. Mm-hmm. So that's in the first 2 weeks. Again, every month you take the weight. If they're not gaining weight well, could be an issue still with feeding much of the time. Rarely, it can be that a child has got a birth defect, has an underlying problem that can happen a few times. Okay. But the biggest problem many times is just the feeding. Yeah.
Great revelation here for especially first-time mothers. You run to the hospital 100 times. The baby is crying too much, yet it's feeding. Yeah. And Dr. You've mentioned something very important that I'd love you to help inform our audiences. What's the importance of measuring? In the hospital, be told, remove all the clothes, the baby remain with the diaper only, measure around here in the arm, around the head, and the height. What's the importance of that and the importance of noting those numbers as you make visits to the clinic?
Yeah, the weight is very important. It's easy to measure anywhere in the remotest of the places, and the weight shows that all the organs are growing well. Imagine this baby has a liver, has a kidney, has a heart, has many organs growing in there, including the brain. So part of that indirect way of measuring their growth is checking whether the weight is increasing. So as long as the weight is increasing month by month, then you know all the other organs are most likely growing. That is the weight. If the baby is not gaining weight well, say now they may not be feeding well, then it means that either the organs are not growing well because they're not getting enough quantity or enough quality of the nutrients that they are feeding on. That is on the weight. On the height, if the baby is getting, if the baby again is not gaining the height well, could be an issue of hormones. But you have to be careful with the families because some families are relatively not as tall as others. So, but if you find the baby is not gaining height well, maybe they have a deficiency of growth hormone or a few other hormones. That could be a problem, or they have a genetic problem like dwarfism, or they have just to mention one. Then the head circumference is very important because in the head is a box that doesn't expand. It's bone or round. So if the head circumference is has got it has the sutures, the suture lines, the spaces between the bones that allows for the growth. If the head circumference, if there is an abnormal growth of the brain, like say you have fluid in the brain, what is called hydrocephalus, then the head will grow very fast, and therefore instead of getting the 2 centimeters we talked about in the first per month, in the first 3 months, it may be 3 or 4 of the same centimeters per month. So you may be able to pick abnormalities of the head, things like hydrocephalus. Few times you may have a brain that is not growing as fast, what we call microcephaly. That means the brain may not be increasing in size as it should. Again, these are not figures that are taken one off. They are figures that are taken every month. That's why it's very important for every mother, regardless of the order of the baby, whether it's baby number 1 or baby number 5, they should all be going to the clinic every month for someone to just have a look at that baby in terms of that. So that it is important that for those weights to be taken. The one for the mid arm, we take that for babies whom we think they have malnutrition.
Yeah.
If a baby is undernourished, then those specific times one may take the mid upper arm circumference. That's up here. We don't take that routinely.
Okay, thank you, Dr. So let's get deep into the discussion now. 0 to, or let's say one day to of birth to 2 years, very critical stage in a child's growth and development. So could you take us through what happens, from the time the child is born all the way to 2 years, and what we need to bear in mind, or what should be the milestone that a child achieves in that period?
Yeah. So we have talked about weight, height, and head circumference. You can just look at how a baby looks.
The appearance.
The appearance.
Okay.
Or better still, how they look at you. So in the first day of life, most babies will have closed eyes, and mothers will be wondering, why isn't my baby looking at me? And they may be having that closed eye look for the first 1 week. By second week, they open up the eyes. By the first month, 2 months, they can have crossed eyes because they can't look straight. The eyes may be crossing, and that happens once in a while. And then by 4 months, the eyes now can look straight and they can focus on you. And if you're giving them nice smiles, they'll focus on your eyes. They love smile. They love looking at their faces of whoever is with them. So they can focus on the eyes. They can have an eye contact between 4 and 6 months. And now from there, they can even track your movements. They can follow what you're doing from 6 weeks.
Yes.
They can actually track movement. By 10 weeks, they can even turn their head towards your movement. By 4 months, they can even bed to see where you have gone. So, those are very quick changes that happen in a baby's, something like that, just the eyesight. Then as they go on, if you 6 months, then by the time they're going to 10, by 8 months, they can make faces. They can actually make faces, they can close eyes.
Yes.
By 1 year, they are copying you. If you close one eye, they'll try to do the same. By 1.5, they can even cheat the same things. Yeah, by 2 years, they are communicating with their eyes, yes, they are. If you find a baby that is not doing that, say by 6 months they don't have a good eye contact, then you start getting worried and you want to stimulate that. Um, Problem comes in when parents ignore babies. You know, a mother is busy doing other things and not even looking at her baby. One of the way to help that baby is from day one, look at your baby, look at the baby's eyes, even especially when you're breastfeeding the baby.
Yes.
Talk, look at the baby and talk to the baby. That will stimulate the baby to look up at you.
Yes.
And before feeding, after feeding, all that. And by at least by 4 months, there should be a good eye contact with smiles, with an intentionality of achieving an eye contact. So if you find a baby who is not having a good eye contact as early as 6 months, 8 months, 9 months, sometimes conditions like autism can present in, with those signs. So one needs to stimulate that. And not even autism, some problems of concentration, some mainly concentration can also be picked up as early as that time. So one needs to stimulate the baby by by engaging with them eye to eye contact. So that's just on the eye alone.
But, sorry, Daktari, on what you're saying, a mother or a parent needs to stimulate the baby so as to have that eye contact. What practical thing should a mother do apart from when you're breastfeeding, ensure there is that eye contact?
The biggest attraction to any baby is a mother's face.
Oh,
Yes.
that's so nice.
They love their mothers.
Yes.
So and they admire their mothers. That's all there is for their world.
So the fathers here, what should they do?
By mothers, I mean also the fathers. The close parent.
Okay.
But I mean, in practice, fathers have to work harder because the mother is always breastfeeding the baby.
Yes.
So fathers have to make themselves available and bring their face close to the baby's face. So by the first, say 2 months, babies can see bright light, and they can even see bright colors. So one can bring a bright color next to the baby's face. You can change the color, even the orientation to the light. If there's a bulb up or a bulb on the side, you can move the baby there. That would help the baby to see better. Then by around 4 months, we all love ourselves, and babies love themselves too. If you bring a mirror to the baby, they love it. So mirrors are the best tools that you can actually use to activate and stimulate the eyesight, and even play and even interaction. So when you bring a mirror to the baby, it should be a safe mirror, not one that can be broken, not one that can injure the baby, but one that is safely framed. Babies would love that, and it does help them. So that's a practical way of stimulating the eyesight.
Okay.
And then keeping on moving distance and changing position, changing angles. Those way you'll be able to stimulate the baby in terms of how they are seeing things and how they look at things.
Okay.
Yeah.
And before you move to the other point you wanted to share with us on what you need to watch, we live in a generation where, as you mentioned, parents are very busy. So the children are glued to their screens forever. Even if a parent comes back home, you want to have that eye contact with the child, they prefer the screen. What's the danger of that?
Babies are attracted by bright light and colors. So screens are bright light. So they will be attracted to the bright light. So they will keep on fixing their eyes on the bright light. And what will happen is that a baby who should be learning how to grasp things with their hands become limp and they're not moving them. They're just fixed on the light. A baby who should be walking around and exploring the environment will just be fixed somewhere like a vegetable. They can't look at they can't move much because they are just watching the cocomelon. So,
Oh.
so there is whilst there is a place for that, it is more useful, more beneficial when the screen is kept away for the first 2 years from the baby. So the baby can learn the environment. By wiring, by design, the baby is meant to absorb the whole environment the first 2 years. They should be able to learn and see their home, their compound, their environment, the people around and the people within those first 2 years. Not washing, cow stalking,
Yeah.
and fruit dancing,
Yes.
because that tends to disorient their intelligence, because in reality they may not, as up to now, they won't find a banana singing or a cow dancing. So that tends to lower their IQs. On a serious note, the American Academy of Pediatrics issued a statement several years ago saying children below 2 years, no screens. And talking about screens, one of the Japanese neurologist, scientist, actually not necessarily a neurologist, neuroscientist, he demonstrated that the brain undergoes degeneration, brain death, cell death, when a child is just fixing their eyes on the TV, because the brain grows by multiplication of cells and connection, forming more and more junctions by stimulation. That's what you do even when an adult has a stroke and you're doing rehabilitation, you're doing physiotherapy, you're trying to help more and more nerves to form some more newer connections. So babies do that connection early on in life. So when you remove the stimulation, then you cause degeneration, you cause death or lack of growth and development of the brain.
Okay.
So that's the danger of the screen. Yeah, so back to the eyesight again.
Yes.
The distance, again, you have to keep on increasing the distance, because the babies are usually very nearsighted at birth. They're only wired to see their mother's breast in the first week or the first few weeks. Then they can see the mother's face. Then now they can look for the father or other people around them. And then from there they can look at the environment. So that distance keeps on increasing. And that's why it's important to allow the baby to go outside and be able to see things other than seeing the screen. Because that way they're able, the eyesight is, the eye lens is growing, and the inside of the eye is growing to adapt to different things that the baby is seeing. So that is just on sight alone. Yeah.
Let's now to move to another point that you need to watch out in terms of your child growth.
Even simple things like crying.
Oh, seriously?
Yes.
And the way we avoid, please don't cry.
No. Any baby who doesn't cry on the first day is a big distress to the medical team that is taking care of that baby.
Why?
Because you are worried. Does the baby have a sound? Are they responding normally? Because all babies should cry at birth, or generally cry at birth. It's even a milestone. Even one of the notes taken for all babies at birth is, did the baby cry at birth?
Yes.
So if so you have, in the first, like say the first 1 week, babies will just cry. People think for nothing, but because they have not decoded the language. After 1 or 2 weeks, then the mothers, all good mothers will know that cries for hunger, that cries because the baby has a wet diaper, that cries because the baby is bored, the baby is tired, any of those things. So they cry, communicate. And that's how they communicate for the first 1 month. But the second month, they start cooing and making some sounds. By the 4th month, they start even bubbling. And by 6 months, now they even start making some sounds, including some slight, not really coughing, but they can actually make some throat sounds as they go on. Between 6 and 8 months, they can even make a cough. They can even pretend they are coughing.
Yes.
Yeah, so, and now they stop crying if you respond to that. And by that is connected to speech and language development. Say by around 4 to 6 months, they can bubble, they can do bubbling, brr, and all that. Then from 6 months to around 8 months, they'll have ba, ba, ba if you stimulate them. Then between 8 and 1 year, they should be able to come up with a word. Many, depending on where they are, they'll either say baba or mama or dad or papa. The papa dad seems easier than the mama.
Surely. Yeah.
Or mom for some reasons.
Yes.
So you see that is now on the language. And then just talking about language, by 1 year, they should be able to have at least, a 2-syllable, baba, mama, tata, dada, any of those. Then between 1 year and 1.5 years, they should have clear words, at least 5 of them. Even if it's trying to call auntie, or whichever word is repeated a lot in the house. Unfortunately, people keep on saying no. So baby also knows how to say no.
Sure.
Yeah.
And they shake their head.
And they shake their hand, and they know what that means. Between 18 months to 1 year is a rapid period of development. They move from like 5 words to 50 words, and they can even go there to 100 words. So one should be able to, again, build up on that. From birth, the first 2 weeks, other than complaining the baby is crying, find out why the baby is crying. Try to decode that sound. Is it because the baby is bored, tired, hungry, or wet? Then address that need, and the baby will calm down. Then when they start now, bubbling and all that, then play with them. if you repeat what they are doing, they'll do it more.
Yes.
Yeah, and sometimes you can even teach them more how to make those sounds.
Yes.
And even just using high-pitched sounds, it helps the babies to repeat the same. And then the laughing, the shackling, by around the 8-9 months you're talking about, they should be able to have many sounds. Any sound you can make from bird, from data, all those that they are easy to make. And then by between then and 1 year, one should be able to they should be able to make sound, to make Kriya words. One of the best way of helping these babies on that area of speech and language is reading for them. Reading for them before they are born.
Okay.
Yes. Just reading a Bible.
Yes.
Or just praying together. Then from birth, just saying, by reading for them simple things. The best thing would be bright colors, objects, in picture form.
Yes.
The baby books, they should be having them from as early as day one or the first month or first week. Then keep that routine every day. Show the baby the colors and the name and the object, and they'll be able to pick them. And by 4 to 6 months, actually they can recognize those objects. Yeah, they can actually be able to. They may not be able to call them by name, but they can recognize them. And by 8-9 months, by between 8 and 10 months, they can be able now to almost. They may not be able to vocalize the word, but they can actually they can actually tell you. They can actually identify the object by name. They can hear the name or the word and see the object that you're talking about. By 1 year, most of them should be able to make clear words. It may not the way you are speaking, but they should be attempting to call mom or baba or someone by that time. But then between that and 18 months, they should form clear words, which they may not. Again, it will not be a complete word. May not be water, may just be war. But they're trying to form something.
Yes.
May not be food, could be just a D or foo or something in a component of that word. So they can actually make up those words in their own mind. And by 2 years, then they should be having clear words. So the best way to help that is by talking to the baby before birth, after birth, every day, or the days of their childhood, and reading for them initially, and then reading with them as you show them the objects.
Yes.
Looking for bright colors, bright colored pictures.
So, Dr. You have talked about, child now being able to talk, and I think that's a big one for every parent. Mtoto wangu haongei. I try, you say 2 words, but can't. What should be a point where a parent should be worried that for sure my child is not able to communicate?
Okay, let's say latest is 1.5 years. By 1.5 years, if a child has got no words, then you want to stimulate them or teach them how to talk. And that's a bit late. Ideally, by 6 months, they should be able to babble. Should be making brrr, then repeating from you. And then by around 8-9 months, they should be having clear syllables like ba 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 ta 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 da 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 da. And by 1 year, they should be able to now say baba or mama or ma or ba with an intention of calling someone. The other thing is tied to that is responding to their name.
Yes.
By 6 months, from birth, one should be calling the baby many times by their name. So by 6 months, they should, in a way, be responding when you call their name. They should be turning around in a way. By 1 year, it should be very clear the child is turning to their name. Yeah, so those are simple markers one can take. But by 1.5 years, it's a bit late, but that's when we pick most of them.
Yes.
Because that's when people get concerned. And an interaction in a doctor's room for 5 minutes may not be able to pick all those things. That's why one needs a regular follow-up, a regular check-up, and someone whom they can either call or interact with.
Okay. Wow. Thank you, Dr. Wachira. He's called Dr. Wachira. He's a pediatrician with us as we focus on the topic, your child's growth and development, right here on Hope TV Health Check. My name is Grace Mutisam, your host for the program. And if you have any questions, remember our SMS line is 22232. That is 22232. You can also engage with us on Facebook and YouTube. We are live right there. Drop there your comments. Our handle is @Hope TV Kenya. Let's have this quick short break. We'll be right back.
Hope TV is now available on GoTV Channel 103, Zuku Channel 873, Signet Channel 817 and Star Times Channel 026. Enjoy our uplifting content and family-friendly programming anytime. Hope TV, you look and live.
Hope TV is where you look and live, with an excellent selection of the best Christian programming consisting of local and international content, of inspirational stories, talk shows, Bible commentary, youth, health shows, children entertainment, contemporary gospel music, extended times of worship, live broadcast, news, movies, drama, Christian ministry programs, and so much more. Hope TV is another quality service from Christ is the Answer Ministries, with over 45% of authentic and credible local content every week. Hope TV is a sister station to Hope FM, Kenya's leading Christian radio station, with footprints across the country. Tune in to Hope TV, where you look and live.
Every Wednesday at 7:30 p.m. Spotlight.
Do you feel like they are in a place where they can effect a Barack Obama moment?
When you hear the word of God and you hear Jesus is speaking.
Real talk on real issues.
You know, the Bible says faith without works is dead.
The truth of the gospel that will survive the time is not a health and wealth gospel.
When there is time to harmonize and bring one composite amendment.
With idealistic, thought-provoking guests.
So people come to be serviced, to be encouraged, to be empowered.
When the storm is over, you desire the closeness you have with God.
Hosted by Reverend Edward Furi.
Welcome back to Health Check right here at Hope TV Look and Live. My name is Grace Mutiso and I'm hosting Dr. Wachira with us. He's a pediatrician and you're focusing on your child's growth and development. And thank you for your questions coming through. In a short while, we'll get to them. Our SMS line again is 22223. Let me get that right, lest I confuse with the red. 22232. 22232. Yes, 22232 is the SMS line. At Hope TV Kenya is our handle on Facebook and YouTube. Welcome back, Daktari.
Thank you.
Before we went on break, we talked about, language. So could we now move to other cognitive skills, that will indicate that my child is growing well, or those ones that I need to know you need to see a doctor immediately?
Yes. We can just take something simple as how a child interacts with the people around. In the first, of course, after birth, whoever handles the baby is fine with that. All they want is someone who can hold them to themselves. And but they'll quickly recognize the mom. They recognize the mother by the smell of the milk, the smell of her perfume, the smell of even her soap, her skin, and pheromones, and many other things. And therefore, the baby, when they're held by the mother, they'll keep calm by 2 weeks, 3 weeks. And when they're held by anyone else, they can protest. And that is that. And then even by 6 weeks, they can recognize the mother's voice.
Yes.
Yeah, the mother talks and they keep quiet, or they cry more because they want the mother. So they can recognize the mother by voice. And anyone else who is close to them, that means even the father as well. If the father is constantly talking to the baby, they also recognize that voice. And by let's say, in the first few months, babies don't have permanence. That means if you're in their eyesight, you are there and you are okay, and you are real. When you disappear, they don't know that you are melted, been ruptured, or you have gone. So they don't have permanence. But by 4 to 6 months, they start having object permanence.
Yes.
And now they start, knowing even if you have gone, you are going to come back. And they start looking at which door did you go out through. So they have that cognitive. They have, they're developing that. And then as they go on, let's say now going to 8 months, they start recognizing who are the regular faces around them. The parent, the help, or anyone else, the grandma, the grandpa, whoever is around them. They'll know those faces. And after 8 to 9 months, they start getting separation anxiety. They start, when the mother goes away, they start now feeling more anxious and crying, and it can be serious by that time, and then by after that they start even crying when a stranger picks them up. Some of them can develop that earlier or later after the 9 months. So all those are cognitive things that grow, that develop. And then as they go on, they know, initially I talked about permanence.
Yes.
So when they are holding something and it drops, they don't know where it has gone, whether it has melted, evaporated, all that. But later on, they'll start looking for it because now they know the object is little, it has fallen somewhere. So they start looking for it. And they'll use that later by around 9 months, 1 year. They'll drop it for you to pick it for them. You give them something and they'll drop it for you to pick it. So now they are playing, they're interacting with you. That is on that. And then even in terms of interaction, we talked about smiling.
Yes.
They initially smile with everyone and anyone. But as they go on towards 9 months, they'll frown at strangers. Even by 6 months, some of them, they'll refuse to smile at strangers unless you're friendly. So there are all those cognitive things that grow, that develop, yeah.
Okay. What about physically, the physical skills that they need to have and social skills?
The other skills, you can talk about what you call gross motor, which what most people know. At birth, the head is floppy, they can't sit, they can't stand. But quickly, by the time when they are getting to 6 weeks, if you put them on their tummy, they can actually turn their head both ways. They can even lift up their head well. And then by 3 months, their head is now firm. They can control the head and look at right, left, and both sides. By 5 months, they start attempting to sit. By 6 to 7 months, they can sit without support. And by that time, if you hold their hand, they can stand firm they can bear weight on their legs. By 9 months, they can stand with support. By going to 1 year, they can actually not only stand but even walk with support. Between 1 year and 15 months, they can walk even with no support. By 1.5 years, they can walk around, run around, start climbing stairs, and by 2 years, they are jumping. So those are gross motor that everyone sees. Again, if there's a problem with the brain development, then you'll see a delay very early with the neck support. By 6 months, you see a delay in the sitting. By 9 months, they can't stand. Or by 1 year, they can't walk. Or by 1.5 years, they can't walk around or even jump by 2 years. So you have got all that. You have got all those motor milestones to look at. The other ones are fine motor, what they do with their hands. By 1 week, their hands are fisted. By 6 weeks, they're still fisted. By about 3-4 months, they'll open up and momentarily grip on something, release. By 6 months, they're even trying to grasp when you are eating. They can even reach out to your spoon, to your food, and even pull it toward themselves. And by 9 months, 10 months, they can actually try to hold things with their hands. By 1 year, they are even trying to put this thing with the 2 fingers. So you have got all this fine motor that develops as babies grow. Yeah.
And Doctor, is it standard for all children or it varies per child?
That's why I'm kept on saying 4 to 6 months, 8 to 9 months, 10 to 12 months, because it's an interval.
Yes.
Term babies will be born between 38 and 40 weeks. They have almost a whole 2 weeks, which they are normal. So there is a normal age that if a baby can't, the neck support is not there by 3 to 4 months, then you are concerned. If they can't sit by 6 to 7 months, then you have a concern. If they can't stand with support by 9 months, then you have a concern. If they can't walk by, say, 15 to 18 months, then you have some concern. But what is more important is the progress. Because some babies are born early, they are born small, or some people are slower in life. And that means as long as the baby is making progress towards the milestones, then you just encourage them or stimulate them. Some babies who are born, who have got those delays in the neck support, the sitting, the studying, you intervene very early by doing the therapies, the so-called occupational therapy. These are just interventions to help the baby achieve that motor skill which they are meant to achieve for that age. And that should be, one should not wait for the baby to get late. They should do it before. That's what you call anticipatory intervention.
Yes.
That means if a baby is born and there was a problem at birth and you think the brain was affected because of oxygen, then you start doing therapy immediately at that point, and you do something regular. If by 3 months they don't have a good neck support, then you start doing that, and you don't stop at that. You do it until they're able to, sit, stand, and all that. Yeah.
Okay. I think before we get to the questions, I'd love to ask, so what's the role of the parents or even the family, or the loved ones around the children in ensuring that we are so keen to help this child develop well in the different stages?
I would generally say mothers are for survival. If a mother is not there, baby will not survive. So the mother's primary role is to feed that baby, allow other people to do the other things, but when they are available, as they are available. So the mother should be mainly concerned about the feeding and the normal safety things for the baby. Then everyone else, from the father to the others, and now they worry about the development, the performance, and that goes on for nearly for the rest of one's life. So the baby, the most important things is talking to that baby from before they are born. The father should be there as much as possible. Talk to their baby before they are born, when they are in utero. Talk to them after they are born. Sing for them. Talk to them. Read for them from day one, first week, first month. As they go on to 1 year, then you just keep on increasing the complexity of the language and the speech that one is using, from simple sounds to syllables, to monosyllable, 2-syllable, 3-syllable, on that to sentences as the baby grows. That is reading. Again, playing with the child is everyone's duty. Whoever is around, whether it's a grandma or grandpa, the father, the brothers, the sisters, the siblings, everyone should be playing with that baby again from as early as even 6 weeks or 3 months, so to say. By playing could just be something as simple as just holding their hands and letting them just hold and release. The next one will be just stimulating that movement, keeping on moving near the baby to see them moving. The next one could be taking them out to see the flowers, to see the different colors of the curtains, to see the different types of gates and doors and windows, all that. So just simple things will stimulate that baby. They're not looking for an expensive gadget to play with. They're just looking at someone taking them around the house, see the things that are around them, and then allowing them to hold things. By the 6 months, you talk about grasp.
Yes.
They want to grasp things, and they want to put everything to their mouth. So they help them put something into that mouth and keep on changing the smell and the taste of the food.
Yes.
Not sticking to one particular food that is your favorite. That's a mother's favorite. So it's more or less thinking for like that baby. If you're 6 months today, and a mother is feeding you, would you want to be fed on pumpkins every day?
Oh, no.
Yeah, so it's just stepping to that baby's shoes. If you're 1 year, would you want to just be told no to everything? Don't touch the water, don't touch the bed, don't touch the TV. So it's stepping to that baby's life and try to think, what do they want? By that time, they want to explore the world. The first 3 years, they just want to explore the world. So help them explore that world. In the first 6 months, it's just helping to explore their hand. I talked about the mirror.
Yes.
By 2 months, 3 months, they want to see themselves. Give them a mirror. Let them see themselves. As they go on, let them see other people. Show them other babies. Show them other adults. As you go on, progressively increase their knowledge of the environment.
Okay. Yeah, a lot of work there for parents. Please spot the baby and engage with them.
Yeah.
Let's take what your questions are. Remember, our SMS line is 22232 at Hope TV Kenya on Facebook and YouTube, and we are live. Let's sample some of your questions. Thank you, Keeps, babe, Keeps. You're saying thank you. You're watching and learning a lot for potential moms and dads to be. Please take notes and keep them. You need them for sure. Richard Nyaga is saying, is it okay for a baby to be standing by 4 months?
Yes. By standing, I assume is a baby keeping their legs straight when you hold them up. That's okay, as long as you bear the weight for the baby. The bones are not well formed, so you can't leave the baby to bear their weight. You have to hold them as they stand.
Okay.
Yeah.
Yeah. Two parents, Daniel together with Henry, asking, sorry, do you have any specialists who deal with autism? And then the other question is there a remedy for autism if detected early?
Autism is a spectrum. It's actually called autistic spectrum of diseases. So it varies from anything mild to moderate to severe, and then affects language and development and other behaviors. And worldwide, it's handled by a team. You'll have someone to help with the speech, somebody to help with the occupational therapy, the mannerism and the thing that they may be doing. Then you have got a neurologist to guide again with issues about the brain development. And you have a general pediatrician who is looking at the general development of that baby. So what you need is a multidisciplinary team that will help this family. And if possible, you also have a nutritionist to help with the diet. And you also have a counselor to help with the family to cope with this baby who is developing differently from others. Yeah.
Okay. And a question for twins. Is their growth supposed to be at par? Or one can grow faster than the other?
All the twins, whether they're identical or fraternal, they are two different people. It's not one person. So they're like just two brothers or two different sisters, and they'll grow differently. Yeah, we should not force them to grow at the same rate.
Okay.
Yeah.
Okay. Another question is, so what happens, maybe we've talked about the different ages from day one, from birth all the way to 2 years, which is a critical stage. And a parent will be watching us and saying, hi, I think my child then has grown so fast. Should such kind of a parent be worried?
Not really, because we are talking about age. When you talk about that a baby should be walking between 15 to 18 months, some of them will walk by 9 months or 10 months or 1 year, which is fine. Yeah, so it doesn't mean anything. At the age of 7 years, you can't tell who walks at what months. Yeah, so all babies are different and should be handled that way. What is important is to see the change by month. That every 2 to 3 months, the child is different, has increased in their growth and in their development.
Okay. And one more, what are some of the common infant conditions that are related to delayed milestones in children?
The commonest is things like cerebral palsy.
Explain that to us.
If a baby has got some damage to the brain around the time of birth, mostly it will be from either a difficult delivery, and maybe there was too much time that it was so difficult that it took a long time, and the baby didn't breathe or didn't get enough oxygen, and the brain suffered some damage because of lack of oxygen. Then that baby may have delays in the various milestones we have talked about, all the way from sitting, standing, to hearing, to sight, to any other part, including sometimes having weakness of one part of the body. That is one. The other one is if they have a severe disease in the first few months of life, if they suffer something like meningitis, that would again damage the brain, and it would behave the same way as a baby who also had that. We talked about the damage from lack of oxygen. So those are diseases. Other things would be if a baby had severe jaundice that was not diagnosed and that was not treated well. Again, that can also affect their sitting, standing, mainly the motor milestones. Those are the commoner conditions that would happen. But as somebody mentioned, autism, speech and development, a child may be having, that it may be a delay in that would be maybe a sign of something like autism. Sometimes it could also be a sign of hearing problems. If you can't hear, you may not be able to talk, and therefore there will be a need to assess that.
Okay, and autism seems to be a big thing, the generation you're living now. So for parents, what's the hope? You visited a pediatrician or a developmental pediatrician and has said, yes, your child is autistic, either mild or severe. Where do you start?
The word autism does not define a disease. It defines a spectrum. And could be a child who is just delayed in talking, is tiptoeing, is closing their ears, but may be different from a child with the same symptoms who may be able to speak if they are stimulated, better than someone else. So it's not a sentence. It's not a final diagnosis. it is a warning diagnosis. There is a delay, there is an unusual development in the speech and development and language area, and one is to intervene. And most, when you go to most of the children who have had that, when they are handled well, majority of them do improve. And you find a child who is, able to interact and go to a normal school. A few of them may require special education, and very few of them may have learning disabilities that may actually require them to be helped, assisted in life. So it's a spectrum, and there is hope in the sense that, one, nothing is impossible with God.
Yes.
And then two, medical sciences, God has given them, the doctors and the science as they are better to conquer many of these issues. So there are interventions that are aimed to improving the speech, improving the behavior, improving the intellectual development. And there are many interventions that are there in worldwide that do help with autism.
Okay. And what of a parent who's discovered, yes, my child has delayed, in the different other areas. So what interventions are there for the children?
I think for all mothers out there, the thing is all babies should be followed up regularly in a health center, in a clinic, in a hospital, in a doctor's office. And just because a baby has been seen for the first 2 months or 3 months or 6 months doesn't mean that they're out of danger, because they are developing. And some problems would show well at 3 years or 5 years or 6 years. So they need to be seen regularly so that one does not think that something was missed out in the first 3 months or 2 days of life. So what am I saying is that a good follow-up will identify the problem, and every problem will be sorted out individually. If you find a baby has got a hearing problem, they are hearing aids. Yes. If they have a sight problem, there is an intervention for that. If they have autism, there are multiple interventions for that. If they have got delayed in sitting, studying, walking, there is occupational therapy available for them. So there is a lot of intervention, currently that are available in the country and even outside the country if need be. They can fly out for that if that's an option for them. So the thing is to early identification of the problem.
Okay. And we did talk about some of the social, environmental, issues that parents need to be aware that can affect their developmental stages for their children.
The biggest problem currently is ignoring babies.
Oh, Daktari, what do you mean by that?
Because the average PhD holder, master's holders, degree holder, by 3 months they have left the house and left a class, sorry, I'm saying this on camera,
yes.
A primary school dropout to take care of their baby. The same house girl is cleaning the house, is doing the dishes, is doing the clothes. So the child is ignored. Yeah. There is no one to take care of that child. And what are they given? A screen to keep them busy. So that's one of the biggest tragedy that we have of today. I mean, that's just for a few people. Most people watching us on this program are good parents and they're doing good things.
Yeah.
But out there in another different population,
yeah.
there are people who do that. You find a mother who is too busy, she's working, the father is working, and they have got no time for their baby. When they come in the evening, everyone is on their laptop and they're watching the IEBC or other news, and they have no time for the baby.
Yes.
And that's one of the biggest problems in ignoring babies. And then waking up at 1 year and finding a baby cannot look at them on the face because they never look at them on the eye. I then realize the baby cannot talk because they never talk to the baby.
Yeah.
So not the people who are watching us, but other people elsewhere. So those are the problems that can actually happen. And the solution is to make time.
Yeah.
Babies, in parenting classes, we say children spell laugh as time, time. That means the more time you spend with the baby, the more they feel loved. Yes. And when anybody feels loved, they do better. They do better. Sure. Whether it's talking or looking at you or smiling at you or sitting or studying or walking, they will do it in a better way. And you're able to, to encourage them, motivate them, inspire them to be the best they can be in life. Yeah.
Oh, parents, such a challenge. How many minutes have you spent with your child? Or what quality time have you taken to give your child? Let me sample one question, Daktari. Laura just asking, is it true that when you give your baby eggs, the tongue becomes heavy, hence delayed speech?
Not really. I would say for now there is no relationship between an egg and the speech. as they are. To help a baby speak well is to talk to them early, smile with them, do the sounds with them, expose them to other people, walk them around, read for them every day. That will help with the baby in terms of talking and speech. Yeah, not eggs, not reducing the number of eggs. Yes.
So let the babies eat eggs. So. And another parent just say, my baby isn't mouthing toys. You talked about to play with them and, let them have toys in their mouth. This parent feels happy, that they'll not be choked, but worried, why are they not mouthing? And yet it's normal. Babies are supposed to put things in their mouth.
From around 3 months, babies discover their mouth and their hands, and they put their hands in their mouth. That's not a sign of teething, even when they start drooling and putting everything into the mouth. It's just a stage of development. And they'll do that with their hands, then they do that with their clothes, they do that with their toys, they do that with anything else that comes their way. So it's a normal development for babies to put things in their mouth. So maybe babies are also sensitive to texture, shapes, and surfaces. So one can actually change the texture of the toys, and there are actually teethers, toys out there that a mother can pick and give that baby to their baby to put in their mouth. So they can try different things, and if they think there's a problem, then they can go to any of the health centers, the clinics, the hospitals, the doctors, and the baby can be assessed.
Okay. Dr. you mentioned that a mother is the most important person in a child's life, and we have our viewers who are watching, maybe they are fathers, single fathers, either the mother passed on or something. What's your word of encouragement to them in terms of observing the development of their child?
Fathers are more important for performance and achievement in life. Majority of them, the gentlemen and ladies in Kamete maximum prison, they are there because of an absent father. So fathers are very important for performance and values and achievement in life. So fathers, they need to be there from before the baby is born and support the mother during the pregnancy and sing and pray for their children before birth. And then after delivery, be there, hold the baby and do what they can do as per the time allows, and take the baby and give them an hour, 2 hours every day of the baby's life. Because the baby is looking for stimulation, the father will be there to smile, play more with the baby even than the mother. Fathers are more agile. They can toss the baby that up. They can
and the mother scream.
Yeah, they can make the baby walk. They can make a 2-week baby swim. They can do anything to that baby. They can even put them on their lap. They can put them on the floor. They can stimulate that baby more than the mother can. So fathers are there for performance, but they can actually not so, but for among other things. And the fathers should also feed the baby, and the mother should also stimulate the baby. And so there are roles that can be shared, and even grandparents, where if they are there, even siblings when they are there, everyone can play these roles. Yeah.
Oh, thank you, Dr. Yeah. I think time is not on our side. You're parting short for our great parents who are watching, and parents to be, regarding their child's growth and development in less than a minute.
Less than a minute.
Yes.
Okay. Pray for your baby before they are born, when they are born and thereafter. And then be there for them in all ways, but physically be present in a baby's life.
Okay. Thank you, Dr. Let me conclude with this comment from Laura Vuchete, just saying, appreciate Dr. Wachira for me. He's been my baby's pediatrician for so long. Thank you. You're doing such an amazing job.
Thank you.
Thank you.
Yeah. And hi, Laura.
Yeah.
I know how you have babies.
Okay. Thank you, Dr. And what a great way. I believe as a parent or a parent to be, what you need to do is have quality time with your child and monitor their development. So that usishtukie one day something happened and you're wondering, where was I when all this was happening? My name is Grace Mutiso. I wish you a blessed evening. Keep it Hope TV, look and leave. More programming coming up. And remember, you can watch this live on YouTube and Facebook. If you missed, or you know somebody who really will benefit from this, please share the link with them at Hope TV Kenya. Health Check is the program. Have a beautiful one. Good night for now.